Welcome to my channel. Please like, comment, and subscribe. The dental insurance industry. How did we get here? Outside the industry and across the general public, it is a common misconception that dental insurance is structured and functions similar to a medical insurance. However, for reasons both historical and bureaucratic, dental insurance exists and it typically operates apart from its medical sibling. Cohesion between the medical and dental fields seems so logical that the separation is unsurprisingly baffling to many casual observers or frustrated consumers. The situation deep historical roots set the two fields apart, and they follow different yet parallel truths that are challenging to merge. Disparity in dental care and its proximity to overall health may be traced to the Middle Ages. Elite physician and surgeon, typically located in urban and academic centers, would have had access to texts and the know how to widen teeth, fill cavities, make dentures, and even perform oral surgery, treating fractures and cancers. And similar to present day, those treatments were limited to those with the means to access them, those who could not rely on the village barber surgeon. Some ponder that this is an early example of the split between medicine and dentistry. In fact, this salon piece notes in an oversimplification used to illustrate the split in the middle-aged barbers often treated dental health issues. In actually, uh, in actuality, the role of the barber surgeon is more evidence of early knowledge of the link between oral and overall health. In addition to cutting hair and trimming beards, this individual underwent extensive training via trade guild to function as a sort of emergency room, since the actual practice of surgery was considered beneath a physicians. In addition to assisting with childbirth or performing amputation and treating a variety of maladies and injuries, teeth and dealt with oral complaints. The father of modern surgery, Ambroise Paré, worked with early dental implants, and he was not the first. Fast forward to the Americans, where barber surgeons accompanied early settlers and eventually craftsmen, including Paul Revere, took up the practice. Here we also see early seeds of separation in which the field went from Aristotle's comparative anatomy, which included teeth, to anatomy classes for medical students in the modern United States that excluded them. Medical school here simply did not recognize dentistry. The split in the United States was more fully demarcated when the first formal dental schools was established in 1840. The field had effectively gone its own way and would continue to evolve separately while uh, other countries embraced the more holistic and integrated idea of physical dentists. The American Medical Association, or AMA, contends the establishment of medical insurance was yet another wedge between dentistry and medicine. The medical establishment opposed a publicly funded plan, first proposed in the 1930s, to provide a comprehensive suite of services, dentistry included. Medical insurance grew from there as a privately funded, usually employer-provided system we are familiar with today. Dental insurance, meanwhile, emerged from the labor movement in the 1940s as union benefits. The AMA writes a fundamental difference between the two was medical insurance was eventually positioned as a necessity to protect against large unexpected costs, while dental insurance is a perk, paying for cheaper preventative care. The difference in this case of coverage dramatically affects how dentists and dental practices operate as compared to their medical counterparts. As of 2020, more than half of physical are employed by healthcare organizations such as hospital or physician group. Meanwhile, only 10% of dentists practice in a group structure such as Dental Service Organization or DSO. This means that the vast majority of dentists still practice in a private retail setting. As such, dental practice operations are more kind to small business, similarly assuming the burden of the overhead costs. Meanwhile, physicians have found that there are clear benefits to pooling their resources. In a group setting, this provides affordable access to expensive equipment such as magnetic resonance or MRI machines. On the administrative side, medical billing and coding within large organizations become their own department. Professional medical coding specialists help navigate the complexities of administering insurance claim for broader health. However, dental benefits are sparingly administered by practice staff who generally do not through formal training. For dentists, this means substantially increased administratively costs in the form on-the-job training. Thank you so much for watching this video. Don't forget to give like, comment, and subscribe.